The hospital stay after a hernia repair, if done by open operation, is typically a few days, a laparoscopic a day or two in the hospital. There are certain precautions for patients who undergo hernia repair, whether they undergo the repair by open operation or a laparoscopic operation. We would encourage the patients to be ambulant early and perform routine activity early. However, they are advised against driving for several weeks. For a groin hernia repair done laparoscopically, we would say avoid driving for about 4 weeks. Avoid lifting anything heavy, say about 8 to 10 kgs and above, for about 4 weeks. With an open hernia, typically we would extend it by a couple of weeks more, say 6 to 8 weeks. For post-operative hernias or ventral hernia repairs, we would advise them to avoid strenuous physical activity for 12 weeks after surgery. Now, the use of abdominal support or abdominal corset, particularly in post-operative hernias, is optional. It would seem a wise thing to use this abdominal corset for a month after surgery. Now, the reason for recurrence of a hernia after a surgical repair are many. Number one, if hernia repair is done in an adult without the use of a mesh, the chance of failure can be as high as 25 to 30%. For patients who develop an infection at the site of a hernia repair, again there is a higher chance of reoccurrence. When one uses a mesh, but uses a mesh of an inappropriate size, particularly a smaller mesh than what is required, there is a higher chance of reoccurrence. Also, one needs to take into consideration patients who are morbidly obese have a higher chance of hernia reoccurring. Also, the tissues in some patients, the type of collagen in the tissues has an important role to play in the incidence of reoccurrence of hernia.